So with that being said, I'm going to turn it over to Cliff Babbitt, who is joining us again to discuss eSignature today. And once again, Cliff is our Director of Solutions Architecture, and we're glad to have him.
About electronic signature at a high level, talking about some of the functionality that is, some of you may have, some customers may not be familiar with this feature set, but we also will be going into a little bit deeper dive later. Pam Landry will be talking about some more of the setup in the application for those users who might be a little bit more familiar using it in their environment and may be interested in specific details. So feel free to ask questions through the Q&A interface as we go along here, and if they're more detailed, we may table that for the in-depth session later on. But first, we'll talk about a couple of different aspects of electronic signature. Our application set supports capture on a number of different devices. I'll highlight a couple of devices today, but really the configuration of the electronic signature area where we're capturing those signatures is a big part of the decision process and the workflow behind capturing those signatures. Software is a very powerful tool, and we hope to enable the best workflow processes, but a big part of that is how exactly is the patient going to be interacting with the registration user and the hardware there. So first, I wanted to give you a quick look at a standard or sort of our preferred or suggested installation for a typical registration area. And this may vary slightly depending on the size of the registration desk, how much free space there is there, how many signatures are going to be captured at any given point in time. But as you can see in this photograph, there's a registration user. It might even be a nurse in a unit that's doing work on a PC that's facing away from the patient, and we may want to capture signatures and allow the patient to interact with the form or forms that they're signing, but not other content that the registration user is viewing. So if they're in their registration system, whether it's Meditech, McKesson, Allscripts, Epic, Siemens, all of their work will be on that primary monitor facing the registration user, and we can automatically launch the form or forms for that patient in context for their service, financial code, or financial class, and language, a number of different criteria that if you're familiar with fast print and are printing those documents out automatically today, we can generate those on screen automatically for the patient in those same scenarios. So the patient sees the document she needs to sign here, and there's an external device, a USB attached signature pad. This is a 1 inch by 5 inch surface that's mapped onto the form wherever the signatures may need to be captured. So it may be one signature or multiples. As we go through this, I'll talk a little bit more about how that's configured. But as the patient signs on that device, it also shows up simultaneously on that secondary monitor facing the patient and for the registration user. And again, this is a standard that if the real estate allows it at the registration area, it's a very good solution because the patient can see real time what they're signing. A number of other customers have deployed in areas where space is limited or budget is limited, have deployed pre-printed versions of the forms, have them laminated, or just soft copies that are there for them to see. Otherwise, the patient could also see that on the primary monitor, but that can lead to workflow disruptions for the registration user. So again, they'll capture the signature, place it on the form, and we can archive that into the document imaging repository for the hospital. I'll talk a little bit more about the specifics of how that works as we go through the presentation here. This is just another view of that to give you a sense of what hardware can do in the configuration. As you see here, this monitor is attached to an articulating arm that can swing out. So if the patient is in a wheelchair or is less ambulatory, we can orient that so the patient can see if they're taller or shorter. That can be angled, so it's it allows for the full viewing of that document. And some monitors will also have a limited viewing area. Ironically, some of the cheaper monitors on the market have a lower viewing angle as compared to some of the more expensive models, which can actually be a bonus or a benefit in registration areas where privacy is concerned. We don't want to have other patients see patient information, and so that being faced towards the patient can mitigate some of those concerns. But some of our customers have also considered, I'm not sure how much of this is in use, but you can also use privacy screens. 3M makes some that also limit the viewing angle to only those who are directly in front of the monitor. Some other options that we don't have depicted here, there are a number of USB attached monitors on the market. There are also touchscreen devices. So there's a wide range of devices, and we'd be happy to consult with you based on experiences that we've had or other customers have had in deploying this technology in registration areas. But one key to keep in mind is that this is not an all or nothing solution. You can mix and match depending on areas. So if you want to have articulating arms in 3 to 5 primary registration areas where you get a lot of registration throughput, that can be a solution for one area, whereas another area might have different options for you might have a USB attached monitor or even laminated forms in an outpatient or same-day surgery area where there's a little bit lower volume or limited desk space. So all of that can be mixed and matched depending on the requirements for the area. Again, as the patient's signing on the device, there is an option. Some of these devices are backlit and have an LCD panel, as you see on the screen here, that displays the signature as it's being applied. So the patient can see not only on the device itself, but on the screen simultaneously, along with the registration user, their signature being applied to that field. So it's very high confidence level for the patient in knowing that their signature is being applied to the form exactly where they've been told, and they can see it applied. Then after that signature, the document has been signed, we can print out a copy for that patient on demand. Our default now is to limit that to when it's requested, so we're not printing out superfluous documentation and wasting paper unnecessarily. But some of our customers have also mentioned that automatically printing out some of this patient information and giving it to patients even when they haven't asked for it can become a HIPAA concern or a patient information risk, because the patient may then go put that in a trash can or a dumpster. And even though it's strictly not the hospital's responsibility for that, it de facto can become that, because that that information is still on the campus or in the facility, even though the patient may have placed it there. So as we're signing this, it's becoming a part of the legal document here, and it's a very robust legal signature. I'll talk about some of those aspects here as we go through the functionality of the application. So here we have a screenshot of what the registration user sees. The interface here is, I'll talk about in a moment, but this can be launched directly from a number of HIS systems. So this is while it is an application, it is a very light application. For those of you in IT, it's based on Microsoft's Click Once functionality that will automatically install this on the PC. So there's not, IT doesn't have to go out and install the application everywhere, although the drivers for specific signature devices might need to be installed on the machine. But as they're registering, some of the HIS systems have the capability to automatically launch our application in context for that patient. So as an example, Meditech or McKesson, if they're registering a patient and click on an option to capture signatures, it will launch this interface with the documents already prepared for that specific scenario. So as an example, if it's an English-speaking Medicare patient, we'll generate the normal consent that every patient gets, but may also have Medicare documentation, and may even have some forms that are specific to the patient type or service that's applicable to this specific patient and visit. So as you see on the screen here, there are thumbnails along the left-hand side of the interface that show what needs to be signed or what can be signed for this specific patient scenario. So these have already been prepared and are ready for interaction, and they also are color-coded according to some configuration behind the scenes. First of all, we're embedding information from the registration process automatically on the forms, and we're also making that decision process for what forms need to be generated. But we also can designate whether certain fields are free text fields where we might capture some information that was not already captured during the registration process, like a witness name or something along those lines. We can free text into that using the keyboard, or as we talk about in the mobile eSig portion in a moment, through the tablet PC or device like an iPad. The signature fields, I'll zoom in on this a little bit later, but they have a little signature pad and a pen icon to designate that that's a signable field, and that can be interacted with an external device or a touchscreen PC or an iPad. So, and there can also be checkboxes on the form, but those, the color coding, as you see here, all of these fields are designated as optional, or fields that can be filled out but are not required. And those show up in the application as a blue icon to the end user. They can see that there are fields that can be signed, but they're not required before archiving that into the document imaging repository. Then green indicates that either all signatures have already been captured or that the document has no signature fields on it at all. It may be an informational form, like a page of a consent that doesn't have a signature on it. It's just informational. Maybe we want to display that for the patient or allow them to request a copy of that, but we don't actually need to capture any signatures on that. And then hopefully this is intuitive as well. The consent at the top has a red icon indicating that there's at least one required signature field on that needs to be captured before we archive that. And the configuration is built entirely based on the hospital requirements and the build for their individual forms. So this is customized for each customer. As I mentioned, we have fillable fields and signature fields that will display differently on the form. The fillable fields will be highlighted or filled in blue. I can just click on that with a mouse and activate it with a keyboard. The signature fields I can interact with in two different ways. I can click on a button at the top of the screen that for signing all of those, which will not sign them simultaneously, but walk me through one signature after another. And we often get questions about whether we can have a patient sign in one space and apply that signature to multiple locations on a form or across forms. And the answer is technologically we could enable that, but legally that's not something that we support in the application, because we really in a healthcare environment we need the patient to be able to authenticate each field individually. They need to be able to determine whether they're signing each field, and so we walk that through individually. The registration user, the other option is to enable fields individually. So if we have a witness that needs to sign and she's available now, as the patient is not available, is getting some emergency treatment or isn't available at the moment, we may do that in a different order depending on the patient scenario. We also have the option for enabling checkboxes on the form that can be, again, interacted with a mouse or through a touch screen. And those checkboxes will be active before signatures are applied on the form, as are free text fields. So I can have options in this example to say the individual refused to sign, or there was an emergency situation, the patient was unconscious or is a minor. All of those, again, are customized for facility requirements, and then required fields will be highlighted in red and are immediately apparent to the registration user that those need to be filled out. There can also be a checkbox on the form. I believe Pam will go through some more of the details about how this is configured and some tips and tricks about using this in your environment later on in our user group meeting. There's also now an option within the past year and a half or two that we have tied into the user's login credentials and can self-sign that. So the registration clerk, rather than needing to sign or touch the same device that the patient is using across the table, potentially creating an infection control risk, but also a workflow risk. Now the registration user is signed in. We know that it's Betty who's logged into this machine, and she can simply right-click on this field and self-sign that. And what that will do is it will place a digital signature on the form that tells the software it was electronically signed or digitally signed, and it will embed some of that date and timestamp information on the form. And as you see, the checkbox is now flattened out. This applies the checkbox to the form, and it cannot be changed by a subsequent user. So once a signature has been applied to the form, we remove the ability to interact with those free text fields and checkboxes for legal reasons, again, so that if a patient has signed something and has acknowledged the content of the form, a subsequent signer cannot change that. We can clear that form and update the content, but that removes the signatures for all the previous signers, and then it's a legally robust document. Everybody is confident that their signature applies to all the content on the form as they saw it at the time. The individual signatures, as we talked about before, can be mapped onto the field, so as they sign that, it will be dynamically displayed on the device and on the screen as well. Now, one thing that that is also relatively new for us is support for mobile devices. We came out with mobile eSig recently and have expanded our support beyond just some of the Windows compatible devices to the iPad platform and Android, as well as Windows tablet PCs and the like. But these are some screenshots of the way it looks on an iPad. So similar interface to our normal application. We can select a form that needs to be signed, select a patient, and open that form and interact with it on an iPad or Android device. We also get some questions around this. Today, this is essentially an HTML5 application that is compatible across a number of different browsers, which allows us to use that in an Android and an iPad environment. There is not a Google or Android app or an iPad iOS app at this point in time, but that can be done through the browser and stored on the iPad or Android device as a hyperlink to get into the application and sign forms through here. So one constraint of this is we potentially lose some integration capabilities that you have in a typical registration desk where we may be automatically launching our annotation client. But we can now take this right up to the patient's bedside using a device that maybe the nurses or physicians already have on the units. So again, this is a discussion point that is very important to determining what's rolled out in a facility. We don't necessarily want to introduce a new device for capturing signatures. We want to be able to plug into a device that's already in use in an area. And this is one of the reasons why we enabled the iPad, because we know that a lot of clinicians are, whether the hospitals are necessarily embracing that initially, physicians are more commonly using iPads, and a lot of our customers have strategies or plans to adopt specific technology. So if there are devices in use in clinical units that the nurses or physicians are already taking up to the patient's bedside, we can use those without having additional devices in place just for our signatures. One slight difference also on the mobile technology is that as I click on a signature line, it will display zoomed in for the full screen on an iPad, so I can interact with it with a stylus or even with my finger. So the patient's signature may not look as nice as it would on a signature pad like the Topaz, but it will allow the patient to do that right at their bedside. We embed that on the form just as we do with the other signatures, and now that's available to be sent to the document imaging repository. So with that, one of the things I haven't touched on in much detail yet is archiving that form. Really, one of the biggest benefits of this process is that we eliminate the need to scan these documents in, rather than now having a printed copy of a form with a patient's wet signature on that needs to be scanned. We have all that, the data, metadata for that form that allows us to automatically send that into the document imaging repository, whether it's McKesson's patient folder, Meditech's scanning and archiving, or Cerner's document imaging, or some other platform like Sorian EDM. We have worked with almost every document imaging vendor on the market and have specifications to output those files in a format that will be automatically indexed into your document imaging repository So it will then be essentially viewable real time by anybody that has authority to view that patient's documents within your legal or document imaging repository. So with that, I believe I'm close to up on time on the electronic signature component. Are there any questions that have come in through Q&A or chat that we can address?
We do. We have a few questions here. So the first question is, do you have any customers using tablets to capture eSignature with Formfast in a patient registration environment? If so, how do you handle the security of the tablet device?
That's a great question. I don't, so specifically in a registration environment, that has not been widely deployed. It's kind of a difficult area that our customers haven't necessarily found a good solution for things like that in registration areas. One of our customers recently was looking at deploying iPads. So we're looking into allowing that in those areas, but or supporting the rollout of devices like iPads or tablet PCs in registration areas. But there are a number of concerns that go around that are sort of implicit in that question. The cost of the device, how are we going to make sure that it doesn't get damaged or taken from the facility? We at Formfast, you don't sell the devices or have any real stake in the specific devices that are deployed, but we have some ideas around what options could be deployed there. Some devices have some security built in that will allow tracking that if it does get taken outside of the facility. There are also options for having those tethered, lock down. Certain PCs or tablets can be locked and have the ability to keep those near the registration desk. But that then limits the usefulness of having it as a tablet PC that the patient could take back to their area. Really, I think the iPad and similar devices will allow more flexibility in that realm. So we'd be happy to talk through some of those considerations with you offline and see what would be a good fit for your environment.
Okay, the next question is, how do we get the paper forms onto the tablet? So maybe you could give a little preview of what Luke will show on the form design side.
Absolutely. That's a great question, and as Aaron says, that's really, there's a two-part process to that. And because of the restructuring of the breakout sessions now, you'll be able to see both of those components later in the day. I'm going to try and share Form Designer with you here. 1 second while I bring up a form that's signable. But the first part of that is the design of the form. You can scan in a paper form or convert an existing soft copy of that in PDF or Excel or Word into our form design application. And I'm just checking to see if I've got a good form that I can share with you here.
I know I'm going to put you on the spot there. If we need to save that for Luke's section next, then we can do that.
Yeah, I may try and share that in a moment, but essentially we take that and build it in our form design application, and it will look very similar to your paper today. We'll work with our customers to optimize or configure a template so that the information is standardized across the forms. We have a barcode for the document type and a layout that complies with the HIM standards for space around the edge of the form for the margins and revision numbers and all those details. And then there's a second part that Pam will be discussing in her portion a little bit, taking that form after it's been designed and building it in our application so it's ready for electronic signature. And that's really placing where is the signature going to be applied, if it's going to use a Topaz 1x5 device, that sort of thing. We'll get into that a little bit in both of those sessions.
Okay, another question that came through the chat is launching the eSig capture screen in McKesson specific to launching from McKesson Star or HBF ILE, or can it be launched from either one?
There are a couple of different ways we've launched it from McKesson. I know that we do, with a lot of our customers, launch that through ILE. ILE has the ability to pass that patient context. I'm not sure if about Star without ILE installed. We may follow up with them offline and look into that to be sure. But I believe Paragon also has an option to do that directly now. So there are a lot of different ways that we've done that with McKesson customers, but ILE is the one that we've done the most frequently, and really is a standard offering that that McKesson has.
Excellent.
I see also a question about Highland, if we've worked with Highland OnBase before, and that is something we've done before. We've output to OnBase, and they, along with many of the other vendors like Perceptive's ImageNow, have a very standard way of, they play in the sandbox very well with, and most document imaging systems do, that they accept documents in a standard format with some indexing information, and that's, we've worked with them before and absolutely have that functionality available.
Okay, that looks like that's all the questions we have at this time. As I mentioned, Pam Landry will be speaking on eSignature and some of the best practices for working with that in a bit. So if you have more questions, then you can ask Pam, or we can ask Cliff as well if you have a question specifically for him. But at this point, I'm going to segue into the Form Designer portion of the presentation.